Hello and welcome to week 15 of NUR 1000. The first thing we're going to do is review the practice questions from last week. For question 1, you had to identify comparable or like answer options and then pick the correct answer. The question said, the nurse provides instructions to a client who's being discharged after undergoing a percutaneous renal biopsy. Which statement by the client indicates the need to reinforce teaching? The student put the comparable answer options were B and C. I should not work out at the gym for 2 weeks, and I need to avoid strenuous lifting for about 2 weeks. And that is correct. B and C, those two answer options are very similar. And because they're so similar, it's likely that neither of them are correct since I can only have one correct answer. The student picked a correct answer of A. A fever is normal after this procedure, and that is correct. Question 2, a client has undergone cardiac catheterization using the right femoral artery for access. The nurse determines that the client is experiencing a complication of the procedure if which finding is noted. Comparable answer options the student chose were respirations of 18 breaths per minute and BP of 118/76. And that's usually what I get here. Those are the two answers that students most commonly put as the like or comparable answer options. I would honestly lump urine output in with that as well. So you're correct with B and D, normal BP, normal respiratory rate. The urine output is correct as well. So it has to be a minimum of 30 mLs per hour. There's also a weight-based calculation, but when you're seeing mLs per hour, we want to see 30 or more. So A, B, and D are all normal findings. C is the answer the student chose. That's the correct answer. Pallor or paleness and coolness of the right leg would tell us that there is a perfusion issue. A child newly diagnosed with type 1 diabetes mellitus who is receiving insulin suddenly experiences signs of a hypoglycemic reaction. Which items would the nurse give to the child immediately? This student thought maybe a cup of diet cola and D, half a teaspoon of honey were similar. The similar or comparable, the like answer options were actually C and D. Half a teaspoon sugar, half a teaspoon of honey. These aren't enough to address hypoglycemia, and if you don't know that, you don't need to worry about that. You just want to identify like answer options. The correct answer, the student did pick the correct answer, which is B, 8 ounces of skim milk. And our final question, you got a pill here, a medication used as therapy to treat heart failure. After administering the first dose, the nurse would specifically monitor which parameter as the priority. The student picked comparable answer options as A, respirations, and C is lung sounds. They're both respiratory related. I would say that's correct as comparable like answer options. They picked D, blood pressure is the correct answer, and that is correct. So you're going to learn, if you don't know already, medications ending in PRIL, P-R-I-L, are ACE inhibitors, and they are used to treat cardiovascular problems, and they will result in a decrease in blood pressure. Just a reminder, your reflection paper is due May 4th. The drop box is now open, so if you want to do it early, you're more than welcome to, but it needs to be submitted by May 4th at 11:59 p.m. in order to earn any credit for that assignment. Please remember to review the reflection paper rubric in order to ensure that you get full credit for the paper. Remember, rubrics spell out for you exactly how you earn your points. So if you want to get all your points, look at the rubric when completing the reflection paper. Finally, be mindful if you have any missing assignments that those need to be completed. I can't put in final grades if you have missing assignments. And if you do have any missing assignments, I'll be reaching out to you in the next week or two, reminding you of what's missing and what you have to submit. Finally, let's take a look at our week 15 expectations. This week you need to watch the week 15 greeting, which you're currently listening to, so you're good there. Then you're also going to view 3 group presentations. So you review each one, and you want to be mindful when you're reviewing these because they come into play for our discussion board assignment. For the discussion board assignment, you're going to pick one of the group presentations, not your own. Watch for week 15 and describe one thing that you learned from the presentation or that you thought the group did a good job describing. Then review the NCLEX category presented in the group project and describe how topics of this area have been presented in your first semester of nursing school at Tara. For your peer response, reflect upon the post of a peer and contribute additional information related to the topic. Initial post is due Wednesday by 11:59 p.m. and one peer response is due. I'm going to put this to one peer. One peer response is going to be due by Sunday at 11:59. Biggie, you have quiz number 3 due Sunday at 11:59, and then a reminder. There, I got it updated. A reminder: the reflection paper is due by May 4th at 11:59 p.m. Make sure you're looking at the rubric. The assignment is worth 40 points, and any late submission will not be eligible for points. So that's it for week 15. Reach out if you have any questions at all. Otherwise, I will talk to you again for week 16. Have a good week.